Hello guys, and welcome back to my channel. I am Tommy, I'm a human nutrition student and researcher at the university, and what I do in these types of videos is to synthesize what I learn at the university, the classes of the subjects that I have, and then I explain to you everything for free in these types of videos. Then you will also have the opportunity to have the free diagram I am explaining today for free on my website. Okay, so let's begin. Today we talk about public health. Public health is a new subject that I'm having at the university, and this video is going to be about the introduction to public health. We have three main topics to talk about today, and they are what is the public health, health education, and health promotion. So let's begin. What is public health? To know what is public health, we first need to know what is the concept of health. Well, health has many concepts, and you have to know that for many years they tried to define health as the lack of disease. It was a negative definition of health. Today we know that it is much more than the lack of disease, and we have the term One Health, which means that the human health has to be in balance with the animal health, and these two must be in balance with the environment. This is the concept of One Health. And health has a lot of determinants. Why do we consider a person as healthy? Well, a lot it depends on the human biology of the individual and his lifestyle, the healthcare system in the country he lives, and also the environment in which the individual lives. Because these are factors that determine if a person is healthy or not. Health, the concept of health, I define it by the individual. But when we talk about public health, it's not the individual, it's the population. So it's to apply these concepts to a big group of people. And public health is exactly that, focusing on populations and not individuals. And you have to know that there are populations inside a population. A population is a group of people that tends to live near each other in a small given territory, and they do share some things in common. Public health also focuses on preventive medicine, that type of medicine that focuses mainly on not having the disease than to curing it. And here we have three types of prevention: primary prevention, secondary prevention, and tertiary prevention. Primary prevention is the type of prevention that we follow when we are healthy and we feel fine, but we follow some habits or some strategies to avoid getting the disease. The secondary prevention is when we have been diagnosed with a disease and it's in early stages, so we still have the time and the opportunity to apply this type of prevention and to treat it as soon as possible. And then the tertiary prevention is when we have fought the disease, when we have been through the disease and we won against it, we follow these recommendations to prevent getting it again and to recover quickly. Okay, so now we have an idea of what public health is. Public health has to do a lot with health education. And health education is all about teach how to think, not what to think. And this is very, very important. And this should be also in every educational system. So here we find the concept of health education is to make citizens responsible for defending health. in an individual state and in a collective one as well. So here we talk about both. This is the public health and this is the term of health as an individual. Then we have the preventive fields of health education. Preventive fields such as family, school, work, the community, and also the patients. These two share between them the educator phase, because you have to know that to teach, we must have an educator or a professor. The educator here must create a community. The educator must talk to people, talk with people, make people talk with each other, be an example for the group, put in practice what he teaches, and also control everything overall so no one is lost. And of course, health education needs some phases of education. And these are the phases they follow. An objective, why do we teach? The contents, what to teach? Methodology, how to teach? And an evaluation, with what results? So after applying this, what do we get? And then we have health promotion, which is not the same as health education. The concept of health promotion is to increase the control on the determinants of health. Do you remember the determinants of health? These ones. The human biology, we don't really have much control on the genetic profile, but we know how the body works. And we can change the lifestyle, the healthcare system, well, more or less, and the environment. Altogether, we can make a change, of course. So health promotion is all about increasing the control on those determinants. For example, advising to not contaminate your environment because it's going to be bad for your health, or maybe don't eat that type of food because for your human biology is not appropriate. And something more can be like do these types of exercises because they are healthy for you and they promote a healthy lifestyle. So in health promotion we have intervention areas. Interventions to promote health. Well, everywhere basically. As you can see, we can have campaigns, we can use the media, the social media. Then we have also the social learning theory and peer education. The social marketing, this is when we promote health on a market basis, like supermarkets, and promote healthy products for people. Then we talk about healthy places, and here comes the concept of healthy cities, and of course intersectoral healthy policies, just to promote health on every part of society. The intervention areas focus on health problems, the lifestyles, vital transitions, for example, when we go from being a child to a teen and then to an adult, and of course apply multi-sectoral strategies, as I said here. And we arrive here. Sick individuals versus sick cities. What's the difference between these two? Because you have to know that if we look only at individuals, we will not see the bigger spectrum. Sick cities is the term that we use, for example, when we detect that many people on that area are sick for the same reason, and maybe we talk about a sick city. That's when we, for example, have healthcare system problems or environmental problems. These are the main factors that lead to sick cities. And sick cities reminds me also of the term sick society. And there is a funny comparison in which they say, is the individual sick or the society that is sick? So to recap what we have learned today, we view what is public health, the concept of One Health, the health education, and the health promotion. I hope you understood everything I said. If you have any doubts, there is a comment section down below. Remember to like, subscribe, and share this video to your friends and family so they can also know what public health is all about. If you click on the first link in the description below, you can download this diagram for free and study it very well. This is the first video of a series. Take care and see you on the next one. Ciao!